Chapter 7, The Axial Skeleton. The entire skeletal system is divided into two categories, the axial skeleton and the appendicular skeleton. The axial skeleton consists of the skull, vertebral column, thoracic cage, and the ear ossicles. Also included is the sacrum, the appendicular skeleton includes the extremities and their girdles, the pelvic and pectoral girdle. The pelvic girdle consists of the coxal bone. The pectoral girdle consists of the clavicle and also the scapula. The cranial bones. There are 8 bones that make up the cranium. Two of those bones are paired. The names are 6. In other words, the frontal bone, the parietal bone has 2. The parietal bone is a paired cranial bone. The occipital bone, the temporal bone, is a paired cranial bone. There are 2. The sphenoid bone and the ethmoid bone. So there are 6 cranial bones in total. There are 8 bones because there are 2 that are paired. The temporal bone and parietal bone are paired bones, meaning there's one on one side and there's one on the other side. The frontal bone forms the forehead, roof of the eye orbit, and most of the anterior cranial floor. The supraorbital margins are thickened above the eye orbit. The frontal sinuses are deep to the frontal bone. This is the frontal bone. These are the superior supraorbital margins. The parietal bones forms the greater portion of the sides and roof of the cranial cavity. Remember, the parietal bones are paired bones. The occipital bone forms the posterior part and most of the base of the skull. The foramen magnum is a large opening where the medulla oblongata connects to the spinal cord. The occipital condyles articulate with the atlas. The external occipital protuberance and nuchal lines are areas of muscle attachment. The temporal bones are another paired cranial bone. Forms the inferior lateral sides of the skull, part of the cranial floor. The zygomatic process of the temporal bone articulates with the temporal process of the zygomatic bone. This is the zygomatic process of the temporal bone. The mandibular fossa articulates with the mandible, forming the temporomandibular joint. The external auditory meatus directs sound waves into the ear. A common term for the external auditory meatus is simply the ear hole. The petrous portion houses the middle and internal ear. Carotid canals can be seen in the temporal bone and house the internal carotid arteries carrying blood to the brain. The sphenoid bone lies interior in the skull. It makes up the middle and base of the skull. One of the landmarks of the cranial floor, as it articulates with all other cranial bones, holding them together. Inside the body of the sphenoid bone is the sphenoid sinus. The sella turcica contains the pituitary gland, which is a very important endocrine organ. The pterygoid processes form muscle attachments for muscles that move the mandible. The ethmoid bone is a small bone that is located in the anterior part of the cranial floor, medial to the orbits. It forms the upper part of the nasal septum. The cribriform plate forms the roof of the nasal cavity and contains the olfactory foramina through which smell sensations are transmitted to the brain. The crista galli, which scenes in the anterior fossa of the skull, serves as the attachment site for the meninges that protect the brain. The perpendicular plate forms the superior portion of the nasal septum. It is perpendicular to the roof of the mouth, or hard palate. The ethmoid sinus or ethmoid cells are air spaces inside of the bone. The superior and medial nasal concha increase the surface area of the nasal cavity. It helps with speech resonation. The facial bones. There are 8 total facial bones. 6 are paired. That makes 14 bones in all. The mandible, zygomatic, maxilla, nasal, palatine bone, vomer, lacrimal bone, the auditory oscus, and also the inferior nasal concha. The facial bones. The first facial bone that we'll discuss is the mandible. The mandible is the largest, strongest facial bone. It is the only freely movable facial bone. The mandible is also known as our jawbone. The zygomatic bone, commonly called our cheekbone, articulates with the maxilla, frontal, sphenoid, and temporal bones. This is the maxilla. The maxilla forms our upper gums and helps to form some of our nasal cavity. The maxilla also helps to form our hard palate or roof of the mouth. Posterior is also the palatine bone. The vomer forms the inferior portion of the nasal septum. Also in our skull are sutures. Sutures are where the cranial bones fuse in an infant right around 1 year old. Before the fusion of these bones, we have soft spots. Those soft spots are known as fontanelles. The sutures are squamous, coronal, lambdoid, and sagittal suture. the sagittal suture. The squamous suture separates the temporal bone from the parietal bone. The coronal suture separates the frontal bone from the parietal bone. The lambdoid suture separates the occipital bone and the parietal bone. This is also the lambdoid suture. And the sagittal suture separates the parietal bones.